Hello, and welcome to the Geistlich Fibro-Gide introductory training. Geistlich, the leader in regeneration, has been bringing innovation to regenerative dentistry for over 30 years, specifically related to addressing soft and hard tissue regenerative procedures. Thank you for joining us to discover Geistlich Fibro-Gide, the alternative connective tissue graft. To begin this journey, let us first explore how our expertise in tissue regeneration has led us to this new breakthrough soft tissue product. During our time together, we will cover treatment solutions for soft tissue defects in the oral cavity and alternative treatment modalities. Introduce to you Geistlich Fibro-Gide and the clinical research that led us to this innovation. Most importantly, we will address how you can incorporate Geistlich Fibro-Gide into your practice. Founded by Edward Geistlich over 160 years ago, our college expertise began in the processing of animal-derived collagen, which, over time, has brought us to our focus in oral regeneration. In 1986, we introduced Geistlich BioOs, the first bovine-derived bone substitute utilized successfully in guided bone regeneration, followed by Geistlich BioGuide, the market-leading resorbable collagen membrane, and more recently, Geistlich Mucograft, a soft tissue augmentation matrix designed for the increase of keratinized tissue, while also providing an opportunity for open healing. Together, this portfolio is the most researched platform of dental biomaterials, backed by science, with over 1,000 clinical studies. The newest addition to our soft tissue family, Geistlich Fibro-Gide, is the first volume-stable collagen matrix designed for soft tissue regeneration within the oral cavity. But in order to understand its properties, let us first compare it to the original collagen matrix, Geistlich Mucograft. Utilized successfully in recession coverage defects and in vestibular-plasty procedures, where a gain of keratinized tissue is desired, Geistlich Mucograft, with its unique bilayer structure, mimics the epithelial and connective tissue layers of a free gingival graft, allowing it to be exposed in the oral cavity for open healing. Its dense outer structure serves a protective barrier function, while the spongy inner layer stabilizes the blood clot and creates an environment for soft tissue ingrowth and proliferation. Manufactured with reconstituted type 1 and type 3 porcine collagen, Geistlich Mucograft integrates into the recipient site with rapid vascularization and minimal inflammation. When surrounded by keratinized mucosa, the cells from the neighboring connective tissue will infiltrate into the matrix and regenerate new keratinized tissue. Similarly, as a biological support under a coronally advanced flap, Geistlich Mucograft helps maintain long-term root coverage. What about the clinical case where there is a lack of mucosal volume? Around a dental prosthesis or natural tooth, the lack of soft tissue thickness can lead to less desirable aesthetics. Furthermore, evidence suggests that adequate mucosal thickness leads to a healthier peri-implant tissue complex. For decades, autogenous soft tissue grafts have been used to thicken the mucosal environment around teeth, implants, and edentulous sites. The subepithelial connective tissue graft has been widely studied and is considered by most to be the gold standard for soft tissue augmentation. With its own native cellular content and biological substrate for tissue integration, it is the most biocompatible material for grafting procedures. However, it does require a second surgical site, which could lead to increased postoperative pain, bleeding, and other morbidities. As well, the quality and amount of tissue that can be harvested is limited by the patient's own anatomy. This second surgical procedure requires additional chair time for the practitioner and potentially additional post-operative visits for the patient. So, does a viable alternative to this time-tested technique exist that might increase patient acceptance? Geistlich Fibro-Gide is a new porcine resorbable and volume-stable collagen matrix intended for soft tissue augmentation, indicated for localized gingival augmentation to increased keratinized tissue around teeth and implants, alveolar ridge reconstruction for prosthetic treatment, recession defects for root coverage. Its porous collagen network supports angiogenesis and formation of new connective tissue, while maintaining its volume stability. The porous structure allows Geistlich Fibro-Gide to quickly stabilize the blood clot, and in doing so, provides a nutrient-rich scaffold for fibroblast ingrowth and proliferation. As the matrix slowly gets replaced by native soft tissue, volume is maintained. So compared to subepithelial connective tissue grafts, Geistlich Fibro-Gide provides an alternative, whereby the patient will not need to undergo an additional tissue harvesting procedure. This saves the provider chair time and eliminates unnecessary patient anxiety, along with the postoperative discomfort. Geistlich Fibro-Gide is a ready-to-use, off-the-shelf product, providing practitioners the alternative connective tissue graft. What inspired this innovation? With a long history of collagen expertise, Geistlich embarked on an ambitious project looking to mimic and optimize the biological functionality, degradation rates, and resistance to mechanical strain found in autogenous tissue. Collagen cross-linking techniques were examined, and early prototypes, over 1,000 collagen matrices in total, were used to culture human gingival fibroblasts and were analyzed for their ability to provide the best environment for cell proliferation. Prototypes that met these requirements underwent chemical cross-linking tests in order to identify the most optimal balance between mechanical strength and biocompatibility. The proprietary Geistlich Smart cross-linking method utilized in the development in this product provides long-term stability and an optimal substrate for cell growth. Geistlich Fibro-Gide underwent mechanical testing and multiple bioreactor cycles mimicking the environment of the oral cavity, confirming Geistlich Fibro-Gide responded, degraded, and performed in a similar fashion to autogenous tissue. Thomas Edison is quoted as saying, "None of my inventions came by accident. I see a worthwhile need to be met, and I make trial after trial until it comes." What it boils down to is 1% inspiration and 99% perspiration. Can the same be said with the pursuit of the alternative connective tissue graft? Finally, preclinical testing was done in animal models with the final candidates in order to ensure biocompatibility and good clinical outcome. The qualities analyzed were soft tissue integration, degradation rate, the potential for angiogenesis, and finally, long-term volume stability compared to autogenous connective tissue grafts. In mice studies, Geistlich Fibro-Gide has been shown to integrate into native connective tissue. At 6 months, 97% of the matrix has been replaced with new connective tissue. In canine models, we see the formation of new blood vessels that vitalize the new formed connective tissue at as early as 7 days, while providing comparable volume augmentation compared to connective tissue grafts over an observation period of 3 months. Recent clinical studies in humans confirm the animal studies. In a randomized controlled clinical trial from the University of Zurich, the investigators looked at soft tissue augmentation around previously placed implants. Geistlich Fibro-Gide achieved similar results to autogenous tissue grafts after 1 year with minimal complications or adverse reactions. Now that we understand the capabilities of Geistlich Fibro-Gide, let us examine the physical and handling characteristics of the material. Please additionally refer to the product's instruction for use. The Geistlich Fibro-Gide collagen matrix is meant to be customized to adapt to the soft tissue defect and can be placed into the surgical site in either a dry or wet state. Hydrating the material is best done with a sterile saline solution or the patient's blood. Due to its porous structure, Geistlich Fibro-Gide is highly hydrophilic, meaning that it will undergo substantial volumetric swelling, around 25%, once it is hydrated. Please keep this in mind when measuring the recipient site and trim the material accordingly. You can adapt Geistlich Fibro-Gide in a dry or wet state. When dry, cutting is most easily performed with a surgical scalpel, and when wet, the use of scissors is recommended. Geistlich Fibro-Gide should be placed underneath a tension-free closure. It may be necessary to adjust the thickness of the material, so you may consider beveling the edges of Geistlich Fibro-Gide to adapt to the soft tissue defect and ensure a passive flap closure. Due to the adhesive nature of the material, suturing is not required in a well-contained surgical site where Geistlich Fibro-Gide can adhere well to the wound bed. However, suturing the material is possible and is dependent on clinician preference and surgical site configuration. Multiple surgical passes may be needed in order to distribute the tension and avoid tearing. In recession coverage procedures, simple interrupted knots, securing the material to the tissue with a fine suture, is recommended. It is important to ensure primary closure of the flap over Geistlich Fibro-Gide. This is especially important since the material will expand when hydrated, and its volume stability is resistant to flap compression. Extensive release of the periosteum may be necessary in order to achieve complete submersion of the material and passive tissue closure. The usual post-operative care and medication for soft tissue augmentation procedures should be followed. Previous studies have indicated that soft tissue healing, i.e., wound closure and the resolution of normal inflammation, occurs within 4 to 8 weeks. But clinical judgment, taking into account the healing of both soft and hard tissues in the treated patient, should be applied before prosthetic treatment. For additional information on the clinical handling of Geistlich Fibro-Gide, please refer to the Handling at a Glance form or the instructions for use. On behalf of everyone at Geistlich, thank you for watching. We look forward to hearing about your clinical success.